Today's Tuesday.
It is Tuesday.
Oh, it means we've got a special guest in
It is. It means
7:30 hour.
It is time for Give 'em Health. Every Tuesday at 7:30, and Give 'em Health is brought to you by your friends at Northeastern Counseling. And today we have special guest Ashley is in the studio with us. Hi, Ashley.
Hello. How is everybody?
We are good.
Thanks for joining us. Ashley, what's your official title?
So I am the Health Promotions Director with the Tri-County Health Department. So just to kind of explain a little bit about what that means, because I think a lot of people know the health department exists. But I don't think,
for sure.
I don't think people really understand the wide array of services that we offer.
Okay.
Absolutely.
So we're just going to take a few times when we come on here just to kind of talk about that a
Okay.
little bit.
Perfect.
So as health promotion, I'm largely, we try to prevent injury, disease, illness, death through things that are largely behavioral, kind of more things that are within your control.
Okay.
Things like quitting smoking if you smoke.
Yeah,
That is the number one cause of preventable death in the world.
Is it really?
It really is. And so, and nobody has to start doing it. So we really want, to educate the community about the harms of that, and maybe even reaching youth and get them to not even start, because it's way harder to quit than it is to even start.
Okay, I have a question actually.
Yeah.
Is that okay? Is vaping, does it have similar repercussions as smoking?
First of all, we don't quite know.
Okay.
Because
it's still
only
early
been,
enough.
It's only been around since 2007, whereas cigarettes have been around
forever.
Right.
Yeah.
So we've seen a lot of the issues with cigarettes that we just don't know the real long-term effects of vaping.
Okay.
But we are seeing some really harmful effects of vaping as well. Plus, the nicotine concentration is really, really high in vaping. And that's the addictive part.
Makes it much more addictive.
Yes. And so kids, if they start young, they're going to be spending a lot of money over time.
Right.
Yeah, for sure.
Buying this stuff. And it's hard to get off of it.
Okay.
So there's that. So that's a big one that we do. We do a lot with injury prevention, and just little things like wearing your seatbelt. Most adults in our area agree that we should all wear our seatbelt every single time, but the rates are going down of people actually wearing them.
Oh,
and
interesting.
It's so easy.
I wonder why that is.
I don't really know what's causing that. I think people just think, oh, I'm not going on the highway. I'm just going down the road.
Right. I'm not going very far.
Yeah. So I'm like, it'll be fine. I don't need to.
I had heard of statistics once that most injuries or most accidents happen within a mile of your own home.
100%.
I don't remember what I
Is
heard
that true?
before.
Yes, that's true. I mean, a lot of the time, because that's what we're doing most of the time.
Right.
Is that we're,
Right.
I feel like it's more the really harmful ones are at the higher speeds.
Sure.
But honestly, where you're going, the intersecting traffic, that's the problem too, where you're not really having that on the highway or the freeway. So
yeah, for sure.
it's all harmful. Really, driving is one of the riskiest things we do, but it's just so common that we just get kind of lax. So let's make sure that we're all buckled in properly. Make sure our kids are buckled in properly with car seats. More with injury prevention, we do make sure that if there's opioids in your home at all, we recommend having Narcan available, just because you just never know, and it's so easy to overdose with those. We've been seeing higher rates.
How do you get a hold of some Narcan?
It's not
something I've seen the signs that say how that has saved people's lives, but if you just
how do you get it?
So we have it at the health department. You just come in, we'll just show you a little video, kind of show you how to use it, and then we can give you some.
Okay.
There's several other community partners that will do it as well. USU Extension also has it. It is available over the counter I've seen it at Walmart. So you can just go there if you want to buy it. But
how is it administered?
So we do the nasal one. So there is an ejectable one, but it's just in your nose.
Just like a nasal
just
spray?
a nasal spray in your nose. So it's really easy.
Okay.
So we just recommend everybody have it, just because if there's even a chance that, and you can use it on children, you can use it on dogs.
Yeah.
You never know.
You never know.
You have a neighbor run next door and say, something's happened. And you go, hey, it's like having a fire extinguisher ready to go, just in case.
Exactly. You kind of hope you never have to use it, but if you do, you'll want it.
Okay.
So, so that kind of stuff. We also do lifestyle, diabetes prevention, heart disease prevention. There's just little things that you can do with diet and exercise that can really prevent that stuff from happening to you.
Yeah, give us what's your biggest tip for those who may be looking in the future? I don't know, maybe someone like me who has just been recently diagnosed as pre-diabetes. What do I need to do?
My biggest thing is to make small changes. Don't completely, because you'll never stick to it if you're like, I'm never eating sugar again.
Right.
That is so hard.
Right.
But what can you add to your diet rather than what am I going to really focus on taking out? Can I add fruits and vegetables?
Okay.
Like add more of those
I love that.
And then eventually, and if you just focus on eating more of that, I feel like the sugar will naturally kind of fall off a little bit.
Yeah, for sure.
Or like, how can you move your body just a little bit more? You know, don't think, I'm going to go run a marathon tomorrow, because that's not realistic. I'm going to go walk around the block today.
Right.
And then just go from
little
there.
Changes,
you know,
little
just
changes.
Little changes. What's just something little that you can do today and then make that a habit.
That's good advice.
That is great advice.
Wonderful.
Okay. Anything else you want to add in, Ash?
Really just, I mean, if you want more information on any of this, you can just go to our website, tricountyhealthut.gov.
Okay.
We also post regularly on social media, Facebook, Instagram. So check us out there. Give us a follow. Post, really good tips. With anything that the health department does, feel free to give me a call. I'll talk.
Call Ashley.
I could talk forever.
She's super nice.
All right. Thank you for coming in.